Aging is often viewed primarily through the lens of physical changes, the graying of hair, the deepening wrinkles, and the gradual loss of physical vitality. We notice the appearance of frailty, the slowed movements, and the inevitable changes in energy levels. However, what tends to be overlooked and arguably the most poignant and impactful aspect of aging is the profound emotional and psychological transformation that accompanies the passage of time. These mental shifts occur subtly, sometimes unnoticed until they build up into a weight that can profoundly affect an individual's quality of life. As the body ages, so too does the emotional landscape, an internal evolution that can feel like an uninvited storm, gathering strength without warning and leaving behind a trail of mental strain and emotional upheaval. For many elderly individuals, these changes often go unspoken, perhaps even unacknowledged, but their consequences are real and deeply felt. The emotional toll of aging, from resilience to fragility. One of the most profound emotional transformations that elderly individuals experience is the erosion of emotional resilience. As the years accumulate, there is a subtle yet undeniable shift in how they respond to stress, anxiety, and the challenges that life throws their way. The resilience they once had to cope with difficult situations begins to fray, and they find themselves more susceptible to feelings of vulnerability. This can manifest in a variety of ways, from heightened sensitivity to stressors that once seemed trivial to an overwhelming sense of anxiety about the future. For many elderly individuals, the realization that their bodies no longer cooperate in the ways they once did is a source of immense psychological strain. The fading of physical strength, mobility, and independence can leave them feeling unmoored, lost in a world that no longer feels familiar or accommodating. In moments when tasks that were once mundane now seem insurmountable, the emotional strain becomes almost unbearable. The mental exhaustion of not being able to live as freely as before can lead to depression, anxiety, and an overwhelming sense of powerlessness. And while these emotional struggles are deeply personal, they are not isolated. They reverberate throughout the relationships these individuals have with their loved ones, often creating a sense of disconnect. The loss of purpose, a cruel companion. Perhaps one of the most heartbreaking aspects of aging is the loss of a sense of purpose or meaning in life. As elderly individuals lose their physical vitality, they often also begin to feel as though their purpose in the world is slipping away. When they were younger, their identities were often tied to their careers, their roles as parents or providers, or their contributions to their communities. As time passes, these roles often change or disappear, leaving a void that can be difficult to fill. This loss can lead to feelings of emptiness and despair as they struggle to find meaning in their later years. For some, this loss of purpose can trigger an existential crisis, where they begin to question their worth, their legacy, and their place in the world. The absence of a defined role can result in a profound identity crisis, where the elderly individual grapples with the question, "Who am I now?" This can be especially hard for those who have always defined themselves by what they do rather than who they are. The transition from being actively involved in the world to feeling like a passive observer can create a sense of disconnection from society and even from their own sense of self. The emotional toll of this transition is immense, as it forces elderly individuals to confront their own fragility and mortality. Loneliness and isolation. The silent crisis. Another silent epidemic that affects the elderly is loneliness. As they age, many elderly individuals experience a deep sense of isolation that is difficult to overcome. In their later years, the loss of loved ones, whether it be a spouse, close friends, or family members, can leave them feeling abandoned and forgotten. The world around them seems to move at an ever-quickening pace, while they are left behind, struggling to keep up. As children grow up, move away, and start families of their own, elderly individuals often find themselves alone, with little connection to the younger generations. This gap, both physical and emotional, widens as technology advances, and new generations increasingly turn to digital communication, which many elderly individuals may find challenging to navigate. The emotional weight of loneliness is especially profound when elderly individuals feel that they no longer have a purpose within the family unit. There was a time when the elderly were the pillars of their families, the source of wisdom, tradition, and nurturing. But as families evolve, roles change, and the elderly are often pushed to the sidelines. Their stories, once cherished by younger generations, may fade into the background as new narratives take precedence. The result is a profound sense of alienation, where elderly individuals feel they no longer matter to those around them. This isolation can lead to a decline in mental health, including depression, anxiety, and a sense of worthlessness. The emotional toll of technology. The digital divide. In today's world, the rapid pace of technological advancement only exacerbates the emotional divide between the elderly and younger generations. While technology is often celebrated for its ability to connect people, it can also serve as a barrier for those who are unable to keep up with the constant innovations. For elderly individuals who did not grow up with smartphones, social media, and instant messaging, the world of digital communication can be overwhelming and alienating. The digital divide only deepens the sense of isolation that many elderly individuals feel. Information, which flows easily and effortlessly for younger generations, becomes a mountain to climb for the elderly, who may not have the necessary skills to access it. The emotional toll of being left behind in this digital world can be staggering. While younger generations are constantly connected, sharing their lives through social media and instant messages, the elderly may feel disconnected from their families and communities. The inability to participate in online conversations or access important resources, such as medical information or government services, can lead to frustration, confusion, and a deep sense of exclusion. The more the world moves online, the more disconnected the elderly feel from the very society they helped build. This growing emotional divide between generations is not just a technological issue, it's a deeply human issue that leaves many elderly individuals feeling invisible and neglected. The shifting dynamics, from pillars to shadows. The emotional and psychological challenges of aging are compounded by a shifting dynamic within families. In earlier generations, the elderly were revered and respected as the foundation of the family. They were the keepers of wisdom, the storytellers, the mentors who guided younger generations through life's trials. But as society has evolved, this dynamic has changed. Families are no longer as closely knit, and the elderly are often seen as burdens or even inconveniences, rather than treasured members of the family. This shift in family dynamics is a painful reality for many elderly individuals. They may have once been the center of family gatherings, offering advice and sharing stories. Now they find themselves sidelined, watching from the periphery as younger family members move on with their lives. The feeling of being irrelevant or invisible within one's own family can be incredibly isolating, adding to the emotional toll of aging. This shift not only affects the elderly individuals themselves, but also has repercussions for the younger generations, who may feel conflicted about their roles as caregivers and supporters. Cardiovascular diseases. The silent killer. Cardiovascular diseases, CVD, are perhaps the most significant health threat to the elderly. The heart, which once beat with power and efficiency, begins to show signs of wear and tear. Hypertension, or high blood pressure, is one of the most common conditions affecting seniors, setting the stage for more severe issues like heart attacks, congestive heart failure, and strokes. However, what makes cardiovascular diseases particularly dangerous is their silent nature. For many elderly individuals, there are no clear signs that their heart or arteries are in trouble until it's too late. Hypertension, high cholesterol, and arteriosclerosis, the thickening and hardening of the arteries, are often present for years without noticeable symptoms. Yet, if untreated, these conditions can cause sudden and catastrophic events, such as heart attacks or strokes, which can leave lasting effects or even result in death. Research shows that nearly half of all deaths in those over 80 can be attributed to cardiovascular diseases, and the impact of these diseases goes beyond the body's physical decline. The emotional toll of knowing that their heart is no longer functioning as it once did can lead to feelings of helplessness and anxiety. The elderly may find themselves faced with the devastating prospect of living with limited mobility or the inability to engage in activities they once enjoyed. Everyday tasks such as climbing stairs or walking become arduous challenges, and the fear of further deterioration looms large. Cancer, the battle against uncontrollable cells. Cancer, which is responsible for nearly 20% of deaths in elderly individuals, is another devastating reality of aging. The body's immune system, which was once adept at fighting off abnormal cell growth, becomes less effective over time. As cells divide and replicate, the risk of mutations increases, and those mutations can lead to cancerous growths. The elderly, especially those over the age of 80, are particularly vulnerable to this process. In its early stages, cancer may be asymptomatic, and it often presents no obvious signs of illness. Because the symptoms can be subtle or masked by other chronic conditions, cancer may not be detected until it has already progressed. For the elderly, by the time cancer is diagnosed, it may have spread too far to be treated effectively. Even when caught early, the physical toll of undergoing treatments such as chemotherapy, radiation, or surgery can be excruciating. For frail elderly individuals, the side effects of these treatments can be severe and sometimes unbearable. The loss of appetite, nausea, fatigue, and weakness associated with cancer treatment only serve to exacerbate the already fragile condition of the elderly patient. The emotional impact of cancer is also profound. For many elderly individuals, the diagnosis can evoke feelings of despair, fear, and helplessness. The emotional strain of coping with a life-threatening illness, combined with the physical toll of the disease and its treatments, can lead to depression and anxiety. Additionally, elderly individuals often experience feelings of isolation during their cancer battle, as their bodies no longer allow them to engage with others as they once did. Stroke, the sudden loss of independence. Strokes, another major cause of death among the elderly, are often the result of uncontrolled cardiovascular conditions like hypertension and arteriosclerosis. A stroke can lead to sudden and irreversible changes in a person's life, from paralysis on one side of the body to severe cognitive impairments. For many elderly individuals, experiencing a stroke is a traumatic event that causes them to lose their independence and self-sufficiency. The loss of autonomy can lead to feelings of frustration, depression, and confusion. Many elderly stroke survivors struggle with the emotional fallout of their condition, feeling angry or ashamed of their newfound limitations. Strokes often result in long-term rehabilitation needs, which can be physically and emotionally exhausting. The fear of not being able to recover fully, coupled with the loss of functional abilities, can lead to a deep sense of grief. This grief is not only for the body, but also for the loss of the life that once seemed so certain and fulfilling. The emotional and psychological impact of chronic diseases. While the physical aspects of chronic diseases in the elderly are undeniable, the emotional and psychological impact is equally profound. For many elderly individuals, the diagnosis of a chronic disease marks the beginning of a slow but steady decline in both physical and mental health. As the body weakens, the mind often follows suit, and many elderly individuals experience a range of psychological struggles. These include anxiety, depression, frustration, and a deep sense of isolation. The emotional toll of living with a chronic disease is magnified by the fact that many elderly individuals also experience the loss of their social networks. Friends and family members may pass away, and as their own physical limitations increase, many seniors find themselves more isolated. This isolation can exacerbate feelings of loneliness and despair. In some cases, elderly individuals may feel abandoned or forgotten by society as the world around them moves on without acknowledging the challenges they face. Furthermore, many elderly individuals find themselves struggling with the idea of becoming a burden to their loved ones. This sense of dependency can be deeply upsetting and may lead to feelings of guilt or shame. The once independent individual may feel as though they are no longer contributing to their family or community. This shift in identity is difficult for many to accept, and it can be a significant source of emotional distress. The importance of support and compassion. As we witness the increasing incidence of chronic diseases in the elderly, it becomes evident that our society must do more to support this vulnerable population. Healthcare systems need to prioritize not only the treatment of chronic conditions, but also the mental and emotional well-being of elderly patients. Compassionate care, including psychological support, is crucial in helping elderly individuals cope with the challenges they face. Elderly individuals deserve to live their later years with dignity and respect. They should not be seen as mere patients but as valued members of society. It's important to foster a culture of empathy and understanding, one that acknowledges the complexities of aging and the need for both physical and emotional care. The elderly need more than just medical attention. They need love, companionship, and a sense of belonging. This societal shift requires the involvement of family, friends, and communities to provide the necessary support networks. Regular visits, phone calls, and involvement in social activities can help mitigate the emotional toll of aging. Additionally, caregivers who offer both physical and emotional support are vital in ensuring that elderly individuals maintain a sense of connection and purpose. The importance of emotional support. As the elderly struggle with their changing physical capabilities, the role of emotional and psychological support becomes even more critical. The need for companionship, reassurance, and care is paramount. In many cases, the presence of a caring family member or friend can provide the elderly individual with a sense of purpose and connection that helps them weather the storm of aging. Social isolation is one of the greatest risks for the elderly, and it can lead to significant mental health problems. When an elderly person is left alone for extended periods, it becomes all too easy for them to slip into loneliness, depression, or even despair. Family, friends, and caregivers play an essential role in countering this isolation. Regular visits, phone calls, and simple gestures of affection can remind the elderly that they are still valued members of society. It is important to acknowledge that emotional support does not just alleviate feelings of loneliness, it also helps to improve physical health. Research has shown that positive emotional states can boost the immune system, lower stress levels, and even enhance the effectiveness of medical treatments. Therefore, the elderly should not only be encouraged to seek medical attention, but also to maintain strong social connections that offer them a sense of love, support, and belonging. The need for preventative care. Given the increased vulnerability to infections and illnesses, it is essential for elderly individuals to maintain regular checkups and screenings. These health checks allow doctors to monitor potential health risks and address any concerns before they escalate into serious conditions. Proactive care can make a significant difference in managing the risks associated with aging and can help prevent the development of life-threatening illnesses. Regular screenings for conditions such as high blood pressure, cholesterol levels, and diabetes can also provide early warning signs allowing for prompt intervention. Moreover, vaccinations are an essential preventative measure for the elderly. Vaccines for the flu, pneumonia, and other preventable diseases are vital in reducing the risk of illness. These vaccines help to protect the elderly from potentially life-threatening infections that can be especially dangerous when their immune systems are compromised. Ensuring that the elderly receive their vaccinations on time can prevent unnecessary suffering and hospitalization, giving them a greater chance of staying healthy throughout their later years. The importance of maintaining a healthy environment. In addition to medical care and vaccinations, creating a safe and healthy environment for the elderly is also crucial in maintaining their well-being. As previously mentioned, cold weather can be particularly harmful to older individuals, exacerbating respiratory problems and cardiovascular issues. It is important to ensure that elderly individuals stay warm during the winter months, both by wearing appropriate clothing and by maintaining a warm indoor environment. This can prevent them from becoming too cold, which can trigger or worsen health problems. Indoor humidity levels should also be monitored, as dry air can irritate the respiratory system and make it more difficult for the elderly to breathe. Proper ventilation can reduce the risk of respiratory infections, while maintaining comfortable humidity levels can help protect the lungs and prevent further complications. Increased risk of cardiovascular diseases and stroke. One of the most concerning health risks during the winter months is the increased likelihood of cardiovascular problems, including heart attacks and strokes. The cold weather significantly affects the cardiovascular system, especially in older adults. When temperatures drop, the body's natural response is to constrict blood vessels in an effort to preserve heat. This constriction raises blood pressure, which increases the strain on the heart. The heart must work harder to pump blood through these narrower vessels, placing immense pressure on the entire circulatory system. For elderly individuals, whose cardiovascular systems may already be compromised by age or pre-existing conditions like hypertension or heart disease, this added strain can be dangerous. It is well documented that the incidence of heart attacks and strokes rises dramatically during the winter months. Studies show that mortality rates related to cardiovascular diseases increase by up to 41% in winter compared to other seasons. This is not just a statistical anomaly. It's a real, growing concern for the elderly population, highlighting the severe impact that temperature changes can have on their health. The silent danger of cold weather. The dangerous part about this increased risk is that many elderly individuals may not recognize the immediate threat. A simple drop in temperature can be enough to trigger a heart attack or stroke, particularly in those with existing cardiovascular conditions. For the elderly, even the effort of getting out of bed or moving around in a cold environment can cause their heart to work harder than usual. The cold's subtle but insidious effect on the body can go unnoticed until it's too late, leading to potentially fatal consequences. What makes this situation even more tragic is the fact that many elderly individuals live alone or without immediate family nearby. This lack of close monitoring means that subtle signs of cardiovascular strain, such as shortness of breath or chest pain, may not be noticed in time. Furthermore, the elderly may not be able to access or afford immediate medical attention when these symptoms arise. This is why it is so important for family members, caregivers, and healthcare professionals to keep a close eye on older adults during the colder months, ensuring they have the proper heating, clothing, and support systems in place to reduce the risk of cardiovascular events. Increased risk of respiratory infections. Cold, dry air during the winter months can wreak havoc on the respiratory systems of elderly individuals, making them particularly susceptible to respiratory infections. The body's defense mechanisms naturally weaken as we age, making it more difficult to fight off harmful viruses and bacteria. Respiratory infections like the flu, pneumonia, and bronchitis are already major health threats to the elderly. But the cold weather exacerbates these conditions, often leading to more serious and even fatal complications. Many elderly people choose to stay indoors during the winter to avoid the cold weather, but this decision can lead to a different set of health risks. Indoor environments during the winter are often poorly ventilated, which creates an ideal breeding ground for bacteria and viruses. The lack of fresh air allows these harmful pathogens to circulate freely, increasing the likelihood of respiratory infections. Additionally, with the limited sunlight exposure during the winter months, many elderly individuals suffer from a vitamin D deficiency, which is vital for a healthy immune system. A lack of this essential nutrient makes them even more vulnerable to infections. The physical and emotional toll of illness. When elderly individuals fall ill, the impact goes beyond just the physical symptoms. Respiratory infections can progress rapidly in older adults, especially when their immune systems are already weakened. A simple cold can quickly spiral into something much more serious like pneumonia, which may require hospitalization. Even when treated, these infections often cause long-lasting effects that make recovery slow and difficult. The emotional toll of falling ill during winter is also profound. Many elderly individuals already struggle with feelings of isolation and loneliness, and being confined to bed due to illness only exacerbates these emotional challenges. The process of recovery can feel discouraging, as older adults struggle to regain their strength. Their bodies, once resilient, now take longer to heal, and the fear of further illness or complications can lead to anxiety and depression. This emotional strain can make it even harder for them to fight off the illness, creating a vicious cycle that becomes more difficult to break the longer it lasts. Preventing respiratory infections. Early detection and care. Early intervention is critical when it comes to respiratory infections in the elderly. The sooner a respiratory illness is detected and treated, the less likely it is to escalate into something life-threatening. Regular medical checkups during the winter months are essential for monitoring the health of elderly individuals. Vaccinations for the flu and pneumonia are particularly important and can act as a protective shield against these dangerous diseases. However, vaccines are not a cure-all, and it is essential to maintain good hygiene practices such as regular hand washing and keeping the environment clean to prevent the spread of harmful pathogens. Increased risk of fractures and falls. Winter months bring with them icy roads and sidewalks, making it much more dangerous for elderly individuals to go outside. For those with weakened bones, such as those suffering from osteoporosis, even a small slip can lead to serious injury. The elderly are particularly at risk of fractures, with falls being one of the leading causes of injury-related deaths among this demographic. When temperatures drop and ice accumulates, the risk of falls increases dramatically, especially in areas with poor winter maintenance. The impact of a fall, more than just a broken bone. A fall during winter is not just about the immediate injury, it is often the beginning of a much larger health crisis. Studies show that the mortality rate for individuals who suffer a hip fracture can be as high as 11.4% within the first month following the injury, and the risk of death within the first year can escalate to between 12 and 34%. These numbers are staggering and serve as a stark reminder of the dangers that elderly individuals face during the winter months. The recovery process for an elderly person who has suffered a fracture is often long, painful, and filled with complications. The elderly body is slower to heal, and the rehabilitation process can be grueling. Not only do they face the physical pain of the injury itself, but they also often experience a significant loss of independence. Many elderly individuals who suffer fractures find themselves unable to perform basic tasks on their own, which leads to increased reliance on family members or caregivers. This burden can be emotionally draining for both the elderly individual and their loved ones. The importance of digestible and nutrient-dense foods. As the digestive system becomes less efficient with age, it's crucial to prepare meals that are easy to digest. This means choosing softer foods that don't place additional stress on the stomach. Avoiding overly heavy or greasy foods can help prevent digestive discomfort, which can become a major issue for elderly individuals. It's important to take the time to prepare meals with care, ensuring that they are not only nutritious but also gentle on the digestive system. By providing elderly individuals with the right diet, we are giving them the tools they need to maintain their health and enjoy a higher quality of life. Proper nutrition isn't just about eating to survive, it's about eating to thrive and ensuring that seniors have the strength to face the challenges that come with aging.